where to help a loved one go for treatment, to understand in a very deep way how the communication and how the treatment will go as it relates to the family. At Galen Hope, we make a very significant investment in our relationship with the families. The families are the people that will be part of the person's life after the person leaves treatment. And even if there's trouble or conflict or disagreement, that is not a reason to not involve families. In fact, that trouble or conflict will be alive and well when the person leaves treatment. So we know it's really important to address those issues sensitively and thoughtfully while the person is with us at Galen Hope. And we make a very big investment in our families. And to be very honest, we do it for ourselves and we do it for our patients. It makes the whole process go so much better when there is that connection, when there is that trust, and when there is that understanding. So we do sort of a three-pronged approach with family. We do family therapy, we do family education, and we also do family coaching. Because each family is going to need a little bit or a lot of each of those different domains. Sometimes families really just need to understand things from an educational point of view. They need to understand if an adolescent has amenorrhea, or if in a male identifying patient they are low weight, they are at risk for osteopenia and osteoporosis. So sometimes families don't understand even some of the basic medical variables. So education is very important. Sometimes coaching is important to just let families know certain things that they can do that are going to help in certain situations or help overall within the family. Just more real practical solutions. And then the therapy piece is also important, where we're getting more into the dynamics and some of the influences on what's happening with an entire family system. We also love to include siblings, and it isn't necessarily a family member per se. It could be an important loved one. So we really expand the definition of who's important in the person's family.